Can you hear me? Good evening. It's a pleasure to be here to talk about the gut and chronic disease. Over the last 10 years or so, there's been an extensive literature that links the gut, chronic inflammation in the gut, actually gut epithelial barrier dysfunction, and you'll learn more about what that is in a few minutes, with many, many chronic diseases. And it turns out that America really does have a chronic disease crisis. 50% of Americans have one or more chronic diseases. 86% of our healthcare dollars are related to chronic disease. And this is increasing despite the very best conventional medicine we have. Many of these are preventable, and we'll talk about that in a minute, and some are actually reversible, says Dr. David Katz, public health professor from Yale. So what's the genesis of this tsunami of chronic disease? Part of it is the gut, for sure, the chronic inflammation, but it's also a foodborne illness. You know, low quality, highly inflammatory foods that are nutrient poor are very much at the root of this as well. This is a famous study. You may have heard of it. It's the EPIC Potsdam study, 2009, in the archives of internal medicine. And they said if you do 4 things, if you eat vegetables every day, if you move daily, that doesn't mean you need to run a marathon, but you need to be active. You need to maintain a healthy weight. That's a BMI less than 30. You don't have to be thin. And if you don't smoke, you can have an amazing 93% decreased risk of diabetes, an 81% decreased risk of myocardial infarctions, a 50% decreased risk of stroke, and a 36% decreased risk of cancer. This study's been validated and replicated now several times. These are solid numbers. And so I'll say that we pretty much got, I think we know now in 2017 how to prevent a lot of these diseases. What I want to focus on, and there's a lot of power in that prevention, is reversing some chronic disease. This is a patient that you might recognize, not specifically, but a patient like this in your clinic. A 50-year-old female with fatigue and melancholy and brain fog and bloating and reflux and diabetes, elevated cholesterol and arthralgias. And over the years, because of the development of these conditions, one after the other, we put her on some important medications, Celebrex and Prilosec and Simvastatin and Cymbalta and Metformin. Do you think, though, it's likely that she has 6, 7, 8 different diseases? Or could there be a unifying underlying cause for this problem? And could it be that some of her medications are part of this? Could the Celebrex be worsening her reflux? Could the Prilosec and the Metformin be worsening her melancholy because of the nutrient deficiencies that occur by using those medications? Could the Simvastatin be worsening their arthralgias? So when patients come to see doctors, they come for many different things: thyroid issues, heart disease, cancer, allergies, diabetes. And us as physicians, we see that, we hear their complaints, and we look to help them. But we don't always look deep enough. We don't always look for the root cause. And could it be things like poor diet and poor relationships and nutrient deficiencies, lack of exercise, and poor digestion? And underneath many of these, or linking many of these, is the gut. This is Nature, 2016. There is a remarkable role of diet, the gut microbiota, and their metabolites in the pathogenesis of several inflammatory diseases. The Institute of Functional Medicine, where I just completed that fellowship, 2-year fellowship, was born of the lab of Dr. Linus Pauling, that some of you might recognize as a Nobel Prize winner in the 1960s, a 2-time Nobel Prize winner. And what the goal of this movement in medicine was to look at etiology more than symptomology. And this has gained so much attention nationally and internationally that the Institute of Functional Medicine partnered with the Cleveland Clinic about 3 years ago. And that clinic at Cleveland Clinic has done so well that they just added a $20 million addition this year. So the gut, all of you know this anatomy and physiology really well, some amazingly well, I'm sure. I want to point out a couple of things. The small gut, bacteria really don't belong there. It is where a lot of the miracles of life happen. You know, you digest your food, you assimilate the proteins, really the amino acids, the building blocks, and the glucose and the fats, and you turn those into the building block of our cells and the energies of our life. A lot of amazing things happen there. It's so important. And then the colon, we think of it really kind of as an organ to store waste until it's convenient, right? But it turns out it's way more important than that, because there are 100 trillion bacteria in there, and there's an enormous crosstalk between those bacteria and our body, our immune system, our brain. It's quite remarkable. The small intestine has this wonderful amplification. The folds, the villi, and the microvilli, you remember all of this well. And then down to the microvilli. And at the level of the microvilli, there's a 1 cell thick epithelial barrier. And this barrier is at risk. Because of this amplification, it's virtually a doubles tennis court large. And so it creates a really difficult problem for a 1 cell thick epithelium to protect that barrier from one side to the other. And it creates a significant immune surveillance problem. There's a lot of immune system that lives around our gut, and if you got to protect all of the things that could potentially get in our body from the gut, it's a big. The gut is the inner tube of life, and really it's the outer world that goes from our mouth to our anus, goes through our body, right? It's what's in the gut is really the outer world, and again, it's a 1 cell thick epithelium that's protecting us. The gut is the largest organ of the immune system. 70% of our lymphocytes live in and around the gut, in the lamina propria, to take care of that surveillance we just talked about. And the enteric nervous system has as many neurons as the brain. The metabolic activity of the gut and the microbiome in the gut, and we'll talk more about that in a minute, rivals that of the liver. JAMA 2017. There are 10 times more bacterial cells in our gut than there are human cells in the entire body. I think you've probably heard that before. If you're not, it's staggering. It's an amazing number. And there's 500 times more DNA, diversity of DNA in that microbiome than the GI microbiome that there is in our DNA. Why is that important? Well, let me give you one example, but there are hundreds, if not thousands. If a person just happens to like spinach, they're going to get exposed to a lot of oxalic acid. And if they don't process it right, they're going to create some calcium oxalate kidney stones, right? But if they have the right DNA and microbiome in their gut, they can upregulate the bacteria called oxalobacter, and within about a day and a half, you're producing enough oxalobacter to take care of all of the oxalic acid that you could possibly eat. Because the doubling time of that bacteria is only about 20 minutes. So rapidly, you can upregulate so that you can have the resilience and the ability to respond to changes in our environment. The microbiome generates proteins, hormones, neurotransmitters, inflammatory cytokines that enter our circulation and affect our health. The microbiome influences disease, obviously cardiovascular disease, diabetes, and cancer. And you're going to see quite a lot here in just a minute. It also significantly is involved in autoimmune disease. 90% of the bacteria in the gut are of two phyla, Bacteroidetes and the Firmicutes. And if you're lucky enough to have a lot of Firmicutes, you're very likely to be fat. It turns out that the Firmicutes bacteria produce a short-chain fatty acid called acetate. Acetate increases insulin resistance, increases the hunger hormone ghrelin, and it increases obesity. If you have more Bacteroidetes, you produce more butyrate, a 4-carbon short-chain fatty acid that decreases inflammation, cancer, endotoxemia, and insulin resistance. We know that we can take bacteria from obese human beings and put them into gnotobiotic mice, that is sterile mice, and we can make those mice fat and not change the amount of chow. We know now that we can take a transplant of the microbiome from one lean man and put it into a man that has metabolic syndrome, and his metabolic syndrome will improve. No other changes but the microbiome transplant. If a patient has a lot of bloating, they're very likely to have small intestinal bacterial overgrowth. Those bacteria that really don't belong in the small gut will emanate hydrogen, will emanate methane. So that's part of the microbiome in the gut. We just talked about the metabolism and how the microbiome affects that. We know that the metabolism of these bacteria can leave small molecules that actually go into our bloodstream, pass our blood-brain barrier, and can affect mood and behavior and appetite. We know that it can affect autoimmunity. It turns out that butyrate, that short-chain fatty acid, increases TGF-beta increases IL-10. Both of those increase T regulatory cells that create an immune tolerance in people. You want an immune tolerance. We know that if you give children in daycare, if you give them a probiotic every day, they're going to have less GI infections than the cohort without probiotic. Interestingly, they'll also have less respiratory tract infections. This is an immune-based phenomena. And we know that if you have the right microbiome, you're going to have less colon cancer. And this is also a very interesting mechanism. The bifidobacterium secretes, again, this short-chain fatty acid butyrate. And butyrate increases the forgive me a second, increases, kind of losing my train of thought on that one, increases the expression of tumor suppressor genes through an epigenetic mechanism. So we are indeed a superorganism, and I think for some of us, it's the question, who's the superintendent? Is it us or the bacteria? This is a paper, January 2017, Diabetes Care, and it talks about how the drug metformin has as one of its mechanisms of action increasing the bacteria Akkermansia muciniphila, and it increases it from about 3 to 12%. And when that happens, you increase insulin resistance, you increase GLP-1, and you improve GI barrier function. And again, we'll talk more about that, but that's very important. It's inversely related to BMI. It decreases inflammation, decreases the likelihood of LPS or endotoxic exposure of the liver through the portal system, so you have less non-alcoholic fatty liver disease. And you can also increase this akkermansia by eating certain foods, like beans and garlic and artichokes and onions. So how do we disrupt our microbiome? That's the Western diet. It's low in fiber and it's high in food additives, particularly the emulsifiers that are in things like yogurt and cheese. Lots of different things like that. Allergenic foods and food intolerances. And then antibiotics disrupt our microbiome. 80% of the antibiotics that we're all exposed to really come from animal husbandry in the food we eat. And then there are the proton pump inhibitors that are just ubiquitous these days. You know, they completely shut down on most people the acid in the stomach. And when you do that, you're going to increase the passage of bacteria through the stomach to the small intestine and increase the likelihood of dysbiosis and the small intestinal bacterial overgrowth. This is the real food pyramid. So if you're eating this, your microbiome is going to be a whole lot healthier than if you eat this. And because, again, this is a low quality, nutrient poor, high glycemic diet with limited amount of fibers and a whole lot of food additives like the emulsifiers I mentioned. This is Autoimmunity Reviews 2015. And it talks about the intestinal tight junction permeability related to industrial foods. So industrial food additives abrogate human epithelial function, increasing intestinal permeability through the open tight junctions, resulting in the entry of foreign immunogenic antigens. This activation of the autoimmune cascade. So one of the underlying significant causes of autoimmunity is the dysfunction of these tight junctions, these open barriers, turning on the immune system. This was on an Egyptian pyramid. Humans live on 1/4 of what they eat. On the other 3/4 lives the doctors. And I think we can teach our patients better. And I think these days, patients, not all of them are going to come to you and say, yes, what can I do to change my diet? But more of them are interested in not necessarily starting another medication. If you give them an opportunity to maybe to change their diet, their lifestyle, and add some of these other things that may help. So how do you cultivate the flora? And you cultivate it through birth and through the birth canal. Mother's vaginal lactobacillus goes up in the last month before delivery. Interestingly now, we know that there's a placental transfer of selected microbes. Placental prenatal transfer. I'm going to talk to you about that mechanism because it's fabulous. Breast milk has 1 million bacteria, bifidobacterium, that wonderful bacteria, per milliliter of breast milk. It's in the milk already. It's not coming from the breast. It also has a bunch of oligosaccharides, which is the special prebiotic that's meant to grow bifidobacteria and lactobacillus. The baby can't digest it. It's there specifically in the mother's milk to grow the bacteria. And we also know that kids that grow up on farms, get dirty, have smudgy, dirty older brothers and sisters, have a whole lot less atopic disease. This wonderful immune cell called the dendritic cell that lives around our gut in the lamina propria and has this long appendage that can stick its appendage into the gut, select specific microbes, bifidobacterium or lactobacillus, bring it back into the lamina propria, ship it along through the lymphatic system to the target organs, the placenta into the breast. How do you like that? This is just the amazing Mother Nature at work. JAMA Pediatrics, 65,000 children. Repeated exposure to broad spectrum antibiotics, 0 to 23 months, is associated with early childhood obesity. This is 2017 University of Arizona. The Microbiota transfer therapy. Okay, we've just sterilized that because that used to be called the fecal microbiome transplant. Now it's microbiota transfer therapy in autism. 80% reduction in GI symptoms. Pediatricians and family doctors have been telling us for years that kids with autism have gut problems. They're constipated, they're bloated, they're crampy, right? They also had a significant improvement in their behavioral symptoms, autism spectrum. So clearly what's going on in the gut, the inflammation, the small molecules can affect brain and behavior. Some definitions. The gut microbiome is all of the organisms, the bacteria, the viruses, the yeast, the bacteriophages in the gut. A probiotic is a live microorganism, be it a yeast, be it a bacteria, be it a parasite that can confer health. Prebiotics are the indigestible fiber that we can't digest that goes through our body to our colon and feeds those wonderful bacteria. And a symbiotic is one that has both. The prebiotic bacteria and the prebiotic fiber and the probiotic bacteria. Sauerkraut's a great example of that, right? It's got the bacteria, the fiber of the cabbage, and all of the bacteria from the fermentation. That's a symbiotic. And then there's the term dysbiosis. And this is a term that's been kind of new to me. And I realized that, as an ER doc and a physician, I've been treating dysbiosis for a long time. Somebody comes in with an otitis externa, that's dysbiosis in the ear. So a woman comes in with bacterial vaginosis, that's dysbiosis there. There's dysbiosis a lot of places. One of the places it clearly is, it's in the gut as well. It's not surprising that you might have some bacterial overgrowth in that place where are an abnormal array of bacteria in the gut or yeast, because it happens everywhere in the body. So this now is the barrier function. And if it works well, at the surface of this one cell thick epithelium, you have the mucus and you have these wonderful protective bacteria. All of the cells are tightly together and you absorb component parts of molecules, glucose molecules, amino acids and simple fats. Things are wonderful. But the barrier can break down. And I'll bet you some of you have heard of leaky gut syndrome from one of your patients because it's kind of in the media these days as the colloquial term for this. But it's really gastrointestinal hyperpermeability. The tight junctions break. And then you allow larger molecules, chunks of protein, of whey, of gluten, gliadin, or maybe chunks of bacteria like lipopolysaccharide endotoxin, right? And this goes through into the venous system of the gut, portal system, and it showers the liver. It also exposes all those lymphocytes that live in the lamina propria to these larger molecules. So those lymphocytes start to make antibiotics. And if there's molecular homology between that chunk of protein and a piece of your thyroid, you just may develop Hashimoto's thyroiditis. Or if there's some sequence homology to your joint capsule, you might develop some rheumatoid arthritis. This is one of the underlying causes of autoimmune disease. Why do you get leaky gut? Dysbiosis, alcohol, nonsteroidals, antibiotics, and stress, and many other. So if you have this endotoxemia, this leaky gut, and these pieces of the gram-negative bacteria showering through there, it goes to the liver and it causes inflammation in the liver, it causes non-alcoholic fatty liver disease, and it causes insulin resistance. This is just a pictorial representation where the barrier breaks down. And many of you may have seen this slide before. This is of the increase in autoimmune disease in the last 50 years. It's exponential growth in many autoimmune diseases. At the same time, infectious diseases plummeted, autoimmune diseases have really went very, very high, and a significant cause of morbidity in our patients. Frontiers in Microbiology, May 2016. Bifidobacterium, a good bacteria, restores gut barrier permeability in mice. Conclusion, these data suggest that bifidobacterium efficiently prevents disorders associated with increased barrier permeability. It turns out that the bifidobacteria actually can help seal those tight junctions. It's a wonderful bacteria. I'm going to mention a few functional medicine tests I'd like to use. This test right here is it's a workhorse in my clinic. It's a functional nutrition test. And the word functional medicine doesn't come from like structural function. It comes from looking at a functional medicine test. Let me give you an example of one that you know very well. You know that B12 levels in the serum in blood are not very sensitive. And if you really want to know if somebody has sufficient or deficient amounts of B12, you need to look at methylmalonic acid. You need to look at the methylation of that. This person is really low in multiple B vitamins. They have malabsorption maybe from atrophic villi or bacterial overgrowth or for aging. I see these patients commonly, and I do some things to try to restore their gut, but not everybody, you can kind of rebuild all of those villi and folds. Some of these people do better with parenteral vitamins, like either subcutaneous or IM or IV, to feel better. I probably got a couple dozen patients in my clinic that I just can't get their B vitamins up, despite oral administration of them. I can give them sublingual B12 and it'll bring it up, but I can't get the other B vitamins up. This is an interesting test that looks for bacterial overgrowth. If you have increased amounts of DHPPA or benzoic acid, these are small molecules that are produced by bacteria in the gut that will increase in the urine of the host if there's bacterial overgrowth in the gut. Same thing for yeast overgrowth. Arabinose is a molecule that's produced by yeast activity in the gut, is absorbed through the gut, and then discharged in our urine, and we can measure that. I talked about the short-chain fatty acids. We can look at those in stool. But one of the things we can also look at is the Firmicutes-Bacteroidetes ratio. And this person, it's very, very low. So the likelihood of obesity is very low. And we can look at the amount of the short-chain fatty acids to get an idea. Do they have a lot of acetate? Do they have a lot of butyrate? Or do they have a lot of propionate, which is more common in autism? And we can look at many different bacteria. And in particular, we can look at that Akkermansia muciniphila, the ratio of that. It turns out that, and I won't spend too long on this slide, but it turns out that several bacteria are specifically related to certain autoimmune diseases. If you have overgrowth of Klebsiella in your gut, you're more likely to have ankylosing spondylitis. If you have overgrowth of Citrobacter, rheumatoid arthritis. If you have overgrowth of Yersinia, Hashimoto's. Again, related to the barrier dysfunction. Now, there's a test that we can look at permeability, and we look for proteins called antibodies to the protein zonulin and occludin. So if you have a lot of tight junction dysfunction, occludin and zonulin make up the tight junction. You make antibodies of this. And so people that have high levels of zonulin antibody have a much higher likelihood of autoimmune disease, celiac, Crohn's, type 1 diabetes, schizophrenia, autism, breast and pancreatic cancer. And it's very likely that you'll see elevated zonulin 5 or 10 years before they develop clinical disease. You can look for small intestinal bacterial overgrowth by a breath test. You're probably aware of this as well. where you can, you feed them a sugar and a sugar solution, and then you take breath samples every 30 minutes for a couple of hours. And if they produce a lot of hydrogen in their breath or methane in their breath, they're very likely to have small intestinal bacterial overgrowth. If they do, they're going to be bloated. You know, you get those patients that come in and tell you that they eat, and an hour later, and if they're a woman, they feel 4 or 5 months pregnant. Have you heard that? Somebody tell you that? That's very often small intestinal bacterial overgrowth. So when food's the enemy, about all of us are, and it is really less important, interestingly, is the IgG related. It's the swelling in the hives and the things that are immediate and drastic in some cases. But 95% of food reactions are related to IgG. And we can test this at Kappa Region. We have IgG-related food sensitivities. They're not acute, they're subacute. You may develop rash a few days later, bloating, some arthralgias, headaches, sinusitis, those kind of things. So it's a very common but less acute. These are the most common foods that people have IgG sensitivities to. Again, we can test that here. How we restore the gut barrier is the 4R program. We remove processed foods. We try to remove allergenic foods, either by an elimination diet or we do it based on that testing. And we try to change the noxious bacteria and yeast. We replace digestive enzymes if they need it. And you can measure pancreatic elastase in the stool, and if it's low, pancreatic exocrine function is likely low. And we try to stop the PPIs whenever we can. We use things like zinc and glutamine that can help heal the gut lining. And there's a medication out called Interrogam, which is an IgG medication that you take orally that can decrease diarrhea and help heal the gut barrier. And then we re-inoculate with prebiotics and probiotics. I want to take you through a couple of case studies here. So this is the woman we met earlier. The workup on her, she had an elevated CRP and she had an elevated A1C. We put her on a pretty simple, nutrient-dense, low-carbohydrate diet with few processed foods. We asked her to emphasize vegetables and meat and fish and berries and nuts and olive oil. We asked her to use time-restricted feeding, that is not to eat 3 hours before bed. Reflux almost always improves with that. And we treated her for dysbiosis, and I'll talk to you about atrantil in a minute. The follow-up in 2 months, her energy was significantly improved, bloating and reflux was improved. She was down 6 pounds, her hemoglobin A1C was now 5.6, her arthralgias were gone. These medications, she was off all of them but one in 2 months. This is atrantil. It was developed by a group of gastroenterologists in Texas. It's actually a herb-based treatment. Peppermint is an antispasmodic. This quebracho is, it absorbs hydrogen gas and it is bactericidal to the methane-producing bacteria. And this conker tree extract is similar to that. Makes a big difference in bloating people. And there are now studies in our literature about it. This is a 21-year-old male that had diarrhea, reflux, and chronic sinusitis. I did IgG food testing on him, and it was negative for celiac but positive for wheat and dairy. I put him on a wheat-free, dairy-free diet, nutrient-dense, and I got him off the processed foods, the pizza, right? Used some dysbiosis therapy, and I'll show you what I used in him in just a minute. Put him on some basic supplements, vitamin D, probiotic, and omega-3s. These are immune modulating. Probiotics are immune modulating, vitamin D is immune modulating, omega-3s are. And within a month, his sinusitis was clear. He had it for several years, and his diarrhea was gone. This is the product I use for that. And it has some herbs in it that we know are bactericidal, right? Garlic and oregano. And caprylic acid is a component of coconut oil that's antifungal. And just to let you know that we're major institutions are using things like this as well. This is Dr. Mullen from Johns Hopkins. Herbal therapy is equivalent to rifaximin for the treatment of SIBO. I use these other ones. I use rifaximin and neomycin and metronidazole and fluconazole for sure at times. But I'd rather kind of prune things back than mow them over, you know. And the herbs, I just don't see very many side effects with peppermint or garlic extract. This is the American Journal of Clinical Nutrition. And they looked at people with seasonal allergies, like March in Missouri. And they said that our study demonstrates a potential benefit for healthy adults with seasonal allergies when a probiotic is administered starting at the greatest level of symptoms. They go on to say that if you started earlier, they actually do better. Probiotics are immune modulating. This is a business owner, 39-year-old female. The standard lab tests were essentially negative, except that her celiac TTG was just under the upper limits. Interventions. And this woman, you know, she was fatigued, she had headaches, you know, they were just changing her life. She couldn't work as diligently as she'd like to and take care of her kids. And nutrient-dense diet, wheat-free, dairy-free, got her off processed foods. I could sing that tune 10 times a day and get benefits in patients. Wheat-free, dairy-free, nutrient-dense, limit the processed foods. Supplements, the same sort of supplements that help with immune modulation. Marked improvement. And I saw her about 4 years ago. I saw her a couple of months ago and she's still doing great. She tells me that when she kind of gets off her diet, you know, at Christmas time, she feels bad for a few weeks, kind of gets back on it. And it really reinforces the wheat-free, dairy-free for her. And she didn't have celiac. She had some non-celiac gluten sensitivity, which is a real entity, about 5% of our population. The journal Headache, December 2012. Our findings indicate that food elimination-based IgG antibodies in migraine patients who also suffer from IBS effectively reduce symptoms from both disorders. Get them off their food sensitivities and reduce. This is a 5-year-old with eczema. IgG foods were positive for corn and eggs and dairy. He had eczema and ADHD. Corn-free, egg-free, dairy-free, low in sugar. And kids, you get them off the preservatives, right? You get them off the colorings, you get them off the processed foods, and you get them on a low glycemic diet. They do so much better. 2 months, the rash was markedly improved, and the teachers reported that his focus was better. 65-year-old female, and this is an autoimmune case that I think I'm really, it was an interesting case. So this woman presented with Hashimoto's and hyperthyroidism with atrial fibrillation. Testing on her, she had multiple IgG positive foods. And the foods, when you have that many, you clearly have leaky gut syndrome. You have hyperpermeability. That's why you have so many sensitivities. She was treated with methimazole and beta blockers. And then I put her in an autoimmune protocol, which is a little bit more aggressive. No grains, no dairy, no nightshades. Treated her for dysbiosis for 4 weeks. Put her on immune modulating supplements, vitamin D, probiotics, high dose omega-3, glutamine, and curcumin. Resolution completely of her hyperthyroidism. Complete resolution of her thyroid antibodies from over 1,000 to normal within about 9 months. I saw her a week ago, and this is about 5 years later. She's still doing well.
Antibiotic-associated diarrhea. Clearly, these antibiotics disrupt the GI microbiota and increase the likelihood of diarrhea. From at least 10% and up to 50% of the time that antibiotics are used, diarrhea will occur related to the use of antibiotics. 50% of these cases are due to Clostridium difficile. A meta-analysis recently showed that there's a 57% reduction of antibiotic-associated diarrhea with the use of probiotics. If you use the probiotic yeast Saccharomyces, it can be given anytime during the day and it will not be affected by the antibiotic. If you're using a broad spectrum multi-species, which is also helpful, then you want to use this at a time different than when the antibiotics are given. I often recommend bedtime. The number needed to treat is less than 2 to prevent significant antibiotic association. What are some good over-the-counter probiotics that you might recommend to your patients? Align, 1 billion CFUs per capsule of Bifidobacter infatis. Culturelle is Lactobacillus GG, 10 billion CFUs, with a prebiotic fiber, inulin. Then there is Flora, which is the Saccharomyces boulardii, 250 milligrams per capsule. 2 capsules would be a dose. And last, a very high dose, VSL3, 450 billion units, a combination of Lactobacillus, Bifidobacter, and Streptococcus. These are all available over the counter, reasonably priced, and can be very effective. Books to recommend. One of my favorite books on the GI microbiome is The Good Gut by Dr. Justin Sonnenberg and his wife Erica Sonnenberg, both professors of microbiology at Stanford. Another clinical book is called The Happy Gut. This is by Vincent Pedra, a practicing physician, integrative and functional medicine physician in New York. And last, The Disease Delusion by Dr. Jeffrey Bland, who is the father of functional medicine and who had trained under Linus Pauling. And the final slide. It has been known now for some time that the gut plays a significant role in chronic disease. After a lifetime of work, Hippocrates concluded that all disease begins in the gut. I'm starting to understand very clearly what he meant by this. What a prescient realization 2,500 years ago by the father of medicine, and I think it holds much truth today. And that's it. I hope you enjoyed the talk.